Hi, my name is Kelvin, and I'll be talking about the second MBBS examination. So, the second MBBS examination comprises of the whole of preclinicals, and in Nigerian schools, it's usually 200 level and 300 level work: anatomy, physiology, biochemistry. So, the idea is that it's actually to test your residual knowledge, because becoming a doctor is a process, not something that happens in one day. So, you're supposed to have had very good very quality study throughout your stay in preclinicals. So quality study, I mean by using standard textbooks and by good videos like NinjaNet and Najib. So now it's, let's say, 3 to 2 months to your exams, and you have a lot of tests that are coming up, and you're having the exams that is coming up. It could be tempting for you to want to focus on the on the exams and then neglect the tests. But one thing I would say is that, based on experience, the test is very important, and the test will add to your cumulative score. And you preparing for the test indirectly is you preparing for the exams, because you would still see the topics of the test inside the exam. So those 300 level tests, those, especially those few tests, those tests that come up before MB, are very, very important. So you could prepare for the two. And the way you could do that is, supposing if you're having a test on maybe GIT physiology, and you want to still prepare for MB at the same time, how you could do that, I will give you an example with anatomy. Or anatomy, just sketch a topic, let's say a region, like let's say upper limb region. You can sketch, make sure you write it down, even though you may not be able to follow up. So you write it down for, let's say, upper limb. You say, okay, this week I'm going to prepare for both tests and my MB. So for upper limb, you could just review, maybe you could write down the regions. You see pectoral region on Monday, on Tuesday shoulder region, on Wednesday arm, on Thursday forearm, and on Friday hand. Then you're also reading your endocrine. So you could, because you already know upper limb, there's no point of you going to get the big textbooks. You could just get a review textbook, or maybe some of your summary, or maybe slides. So you don't need to waste your time. So you could devote, if you're reading like 5 hours a day, you could devote maybe 4 hours to your prep for your test, or you could devote 3 hours for your prep for your test, then 1 hour for upper limb. Then you could also add maybe histology, so that way you're covering more ground. But if to avoid things being complex, you can prepare for the anatomy and your test at the same time. So you make sure that, okay, on Monday, for example, no matter what happens, I'm going to finish reading pectoral region within 1 hour. Then the remaining time I'll have it for my test. So at least during the MD, you don't need to spend your time reading a lot of GIT, because the GIT will still be fresh in your memory. So one thing I'll also say is that what I just said is about memory work, but the main MB exams will be more of problem solving, and there will be a lot of things, because it's going to comprise everything that you've done, and the exams will be extensive. So the STEM questions will be extensive. So I would advise that you focus on past questions for each topic. So as you're reading the pectoral region, you read the past questions in accordance, so that by the time you just go to the exams, it will make so much difference. So reading past questions cannot be overemphasized. Then the practicals will come. Usually the practicals are live and alternative. So past questions will give you a guide to be able to correlate all the practicals you've been doing in such a way that you can actually be able to do it in an exam situation. So just use your past questions to give you a guide. They are usually alternative and live practicals. Then for the Viva, I would say that Viva test concepts, you being able to understand what's happening, and you being able to relate it to problem solving. And they also test your confidence and your appearance. So just appear well, be confident, and just speak clearly. So with that being said, I think that's enough overview for the whole exams. So thank you so much.